Welcome everybody. We'll be starting very shortly. Okay, let's go ahead and start as people are still entering. Welcome to pretty much the last day of the UNC Water and Health Conference 2021. My name is Warner Passanisi. I'm representing the Water Institute here at UNC. I'm the room host for today. And in this verbals session, I want to highlight the networking session that we have in the afternoon at 3:30 on Remo, joining through your Pathable link you use to get through to here. Also, we've got a fun trivia night. Actually starts at 3:30. That's 2 hours from now. Invite everybody to attend. That's through Remo. Again, so you do have to register ahead of time. If you are going to come, it would be wonderful if you could just do that. It takes just a short amount of time to do that. It will be fun, and you'll see some regular faces there as well. So please come and attend if you can. That if you're going to ask questions or make comments, please do so in the chat box here, as you see at the Pathable link that you use to get here. The Zoom chat will be disabled for all participants here. Oh, and I should say all of the files you see in the file section there, everything presented here will be in the file section, and anything asked for subsequently in the chat will be used. That will be the repository for that information. Lastly, I want to thank us for this session. We've got the Limpopo Resilience Lab. We have the USAID Southern Africa Coalition, Well Vision and Clean Water here. And we have 3 exciting presentations today. I'm going to stop sharing for a second and go into that. Let me just see. So what we're going to do is recording this session. Everything here on the screen will be recorded, plus the chat in the Pathable link. We have decided we're going to share in alphabetical order. And first up will be, who do we have? We have Darcy Anderson from the Water Institute here at UNC. With a presentation entitled A Toolkit for Costing Environmental Health Services in Healthcare Facilities. And Darcy, I hand the floor over to you.
Great, thanks. Let me pull up my screen share here. And am I good to go?
Looks great.
Great, perfect. So thanks for being here today, everyone. Today, I'm going to talk about costing environmental health in healthcare facilities. A quick agenda, I'm going to talk about processes for collecting cost data and tools to support costing. I'm not actually going to be covering any data on costs, so if you're here to see the numbers, I'm sorry to disappoint you, but I will refer you to some of the other things that we've published on this topic. They're available at these links in the slides, as well as in the Files tab on Pathable. So to start out, just to give a quick definition to put everyone on the same page, when I'm talking about environmental health in a healthcare facilities context, I'm talking about conditions of the built environment that allow for safe and functional healthcare delivery. So this is everything from the infrastructure to the supplies, to the training, the behavior change, the whole picture. In this toolkit specifically, I'm covering water, sanitation, hygiene, waste management, and cleaning. So you'll often hear referred to as WASH in healthcare facilities, although I will note that the scope of environmental health in healthcare facilities is much broader than just these 5 things that the toolkit covers. So why do we care about environmental health? Why do we invest in it? Well, the first thing that often comes to mind for people is prevention of infections. It's estimated that about 60 to 80% of healthcare-acquired infections are attributable to poor hygiene and other environmental conditions. So by improving these conditions, we can prevent these infections. On a more basic level, environmental health services just allow facilities to operate. If you can't turn the lights on and you don't have running water, it's really difficult to provide services and facilities may need to shut down. There's evidence that it's important for worker satisfaction and worker retention, and particularly as we're all broadcasting this remotely, it's important for pandemic preparedness and strong health systems. If your health facilities can't be open and they can't prevent infections, it's really hard to respond to emerging pandemics. So for those of you that are familiar with the roadmap that the World Health Organization has put out towards achieving universal access to WASH and healthcare facilities or environmental health and healthcare facilities, costing is a really important step towards achieving universal access. Cost estimates are really essential for developing national roadmaps and national plans. For those of you that are familiar with the WHO's 8 practical steps, step number 2 includes setting detailed targets that have a national costed roadmap and estimating costs to achieve those targets. So costing is really essential to planning out how to progress towards universal access. But the reality is that costing is also a big barrier. Only about 1/3 of countries have developed costed roadmaps, and there's really no good tools available that are specific to environmental health in healthcare facilities that can assist countries and individual facilities with developing these national costed roadmaps. So that's where this project comes in. One of our primary goal was to develop a toolkit for practitioners, funders, and specifically other non-researchers. So we're really speaking to a practical audience here to collect cost data. We had a few key criteria that we wanted this toolkit to meet. One, we wanted it to be user-friendly, so something that people could use without having any prior economics or financial analysis experience. 2, we wanted it to be self-guided, so something that practitioners could take up and apply without having external support from, for example, academic institutions. We wanted it to be flexible and adaptable for a wide variety of facility types and contexts. So from small rural clinics only serving a few hundred people to larger district hospitals with much bigger patient populations. And we really wanted it to be paired with instructions, guidance, and tips for success throughout. Again, really speaking to that practical audience and what's going to be usable for them. So to give you an overview of what we came up with, we designed 8 modules to guide users through what we determined to be essential steps for planning and data collection. These pictures here on the right show you what that looks like. So each module contains a set of instructions, worksheets, and templates that users can go through and fill out to complete the toolkit. And these modules are paired with a spreadsheet that comes pre-filled with sample data to get a sense of what the numbers look like, how to enter them in, and that will perform some basic calculations for you. So to dive in a little bit into an example of what these look like, this is an excerpt of a sample module, module 3, that's designed to guide users through data collection planning. And this is what users will see when you open up every module. At the top of each module, there's a goal or a purpose statement. In this case, the purpose of this module is to create a plan for cost data collection, to identify an approach, a location, and data sources to progress through this module. Then each module contains a listing of worksheets. This module in particular is kind of a good overview of the types of worksheets that you'll see throughout this toolkit. Worksheet 1 is a guidance worksheet. So it's a collection of advice, information, tips and tricks for how to collect data and how to select an appropriate approach. Worksheet number 2 is a template. So it outlines key steps and asks toolkit users to fill in how they're going to undertake each step based on the guidance in the first worksheet. And then finally, this third worksheet is an activity. It's a discussion guide that presents questions for toolkit users to walk through the template that they've filled out and the approach that they've designed to really assess, is this feasible? Is it appropriate? given the resources and the timeline that we have available, and to really kind of critically examine the data collection plan and to revise it as necessary. And then finally, the last part of each module that you'll see in this very first introductory sheet is instructions on who should complete it, how and when to complete the worksheets, both within the individual module and also in relation to other modules in the toolkit. So where there's linkages and interdependencies between the modules, those will get pointed out and the toolkit will walk you through the specific sequence and how to complete each one. So I'm going to zoom out here and talk about the big picture process. So we designed our toolkit to map onto a roadmap of data collection steps that we identified that are really essential to moving through this costing process. It divides out into 3 phases. So this first phase being planning, then moving into a data collection, and then a synthesis phase. And I'm going to walk you through each of those and what those mean. So the first phase is planning. These steps are designed to identify a costing purpose. Why are you collecting data? What do you plan to use it for? Identifying the environmental service that's the focus of costing, and identifying the scope of costs. So for example, you may want to estimate the costs of installing new boreholes at 10 rural clinics plus 10 years of maintenance expenses. So your purpose is estimating costs of new boreholes. Your relevant service is water, specifically boreholes, and your scope of costing is installation costs plus 10 years of operations and maintenance. Then the next steps in this are collecting contextual information, developing a data collection plan, and then identifying data sources. When all is said and done, this set of modules produces 4 key outputs. 1, a defined purpose and scope of data collection. 2, an assessment of facility context. So that includes kind of your classic J&P, WASH and healthcare facilities indicators, as well as more detailed information, things like facility size, specific modality of environmental service provision, a data collection plan, and then a list of key informants and information sources. Then we move into the data collection plan. So this is where stakeholders actually, take their data collection plan into the field and roll it out in actual facilities. And then there's a step to step back and really reflect on the data that was collected. So to aggregate all of the different sources where you may have gathered information, to put them all together and evaluate its quality, assess limitations, whether there's a need to circle back and collect more data. Key outputs for this phase are a list of resources used in environmental service delivery. You can think of these sort of as your budget line items. So what are all of the things that you need to pay for? Information on the quantities and unit costs of these resources. So if we think of a basic cost calculation as quantity times unit price equals total cost, those plug into the spreadsheet and will generate some basic numbers for you. And then an assessment on data completeness and accuracy. Then the final phase here is what we're calling synthesis. So in this step, you're calculating costs, crunching the numbers based on what your purpose, what you're trying to achieve, honing in on those costs that are particularly relevant to your purpose, and then sharing and applying those findings with other stakeholders. So key outputs in this step being a spreadsheet that calculates cost, again, using those budget line items, quantities, and prices, and then a dissemination plan to distribute that information to stakeholders. I will close out here with a quick plug that we are seeking collaborators to help apply this toolkit in the field and really take it out, put it to work, and to let us know how it goes. So if this is of interest to you and you're interested in collecting cost data and you might want to use the tool, please reach out. My contact information is there on the screen. It will also be available in the slides, in the files on Pathable. Some next steps that we're thinking about: looking to make refinements and revisions for usability, adding additional environmental services. So things like heating, ventilation, particularly relevant in these times of COVID, laundry. There's a wide variety of other environmental services that aren't included, but that we could expand the toolkit to add on. And then looking at questions like, how can cost data inform planning and decision-making? What do you actually do with these data? How do you apply them? And then how can cost data influence advocacy and policy? So how can we take these data to, say, the Ministry of Health to really engage in discussions about getting the necessary funding to actually meet these universal access targets? So if you're intrigued, if you want to learn more, please reach out. I'm happy to answer questions. We would love to find collaborators to take this to the field. With that, I will direct you all to type your questions into the chat box on Pathable. And while people do that, I will just give a quick shout out to some of my co-authors and our collaborators in the field on this. Folks from the Water Institute at UNC, as well as folks at UNC Project Malawi and the Malawi Ministry of Health, which is where we did a lot of the pilot testing and design of this project. So I will close out here. And
see, thank you so much. We already have some questions, so
perfect.
That's lovely. And I got fascinating stuff. I got so many questions myself as well, but I will hand over. Lindsay, would you care to ask your question live? Please go ahead. Unmute yourself.
Hi, Darcy. Great presentation. Thanks so much. Lindsay Denny here. So given the target audience of a tool like this, and you noted on one of the first slides about the fact that you're looking to have users be non-researchers, practitioners, etc., I'm curious if there's a plan for how to widely disseminate a tool like this. I know you might still be in the testing phase and understanding the feedback and the case studies. And I know there's been a number of articles on this, which I think is fantastic. Love to see that. But I think the scientific community may not be, again, your target group. So just curious about your plans on rollout and what that might look like for folks who are interested in using this.
Yeah, agreed. That's a great question and a really good point. So up to date, we've really been focusing on developing it, making sure that it's, that it works as expected, and that it's kind of in a fit state to be seen by practitioners. And we are just now starting to look towards that next phase, reaching out to I've had it both ways. I've reached out to organizations who I think might want to be interested in this. I've had folks reach out to me. So getting it into things like communities of practice, and distributing it amongst, colleagues and friends who may be in the field who are looking towards collecting data. So it's still something that we're thinking about. It's kind of the next phase of this. And I will again plug, if you are, specifically folks like you, Lindsay, and other folks who may be running communities of practice, I would love to engage with you on this, to introduce it to your team, to see if it's maybe a good fit for you and move forward that way. Warren, I believe, yeah, you're muted.
Forgive me. Thank you. Thank you for your question as well, Lindsay. Are you planning to look at introducing a mobile platform to test some of this as well?
Yeah, it's a good question. It's not something, it's certainly, like, if we had, I'm not a tech savvy individual, it's not my area of expertise. I certainly think that would be valuable. I think mobile data collection really is quite a powerful tool to both, to use in the field, but also as a platform for sharing data. So nothing is in the works at present, but certainly would be very open to collaborating on folks with maybe a bit more technical expertise on that.
Lovely, thank you. I'm intrigued about any best practice focus that you've developed through this study, standardization across countries, but specifically looking at best practice.
Yeah, so it's interesting that you mentioned standardization. I would actually steer away from standardization. One of the things that we really learned about this is environmental health information within facilities tends to be quite disaggregated. It's often managed by several different departments. It tends to not be centralized. So it really takes a lot of digging and adaptability to source it all out and to aggregate it together. So I would actually encourage, as best practices, good document iteration, adaptability, and then good documentation of those iterations. So expect that you're going to develop a plan. It's not going to work out the first time, and then be flexible to go back and revise it. And that's something that we recognize and have integrated throughout the toolkit, is really working on that iteration and adaptability, and then documenting each of those learnings and iterations. And then I would highlight, for a second best practice, integrating diverse stakeholders within the facility. So not just your accountants and your administrators, but folks on the ground, cleaners, maintenance workers, those people who actually interact day to day with service delivery, have really valuable information about things like maintenance schedules and resource needs that you're probably not going to get from administrators and people who work in the office space of the facility.
Thank you. A slight follow-on. I'm wondering about, within your systems plan, are you looking at the timing of each step, at the actual time it takes to complete a step to move on to the next step? I know that's been an issue in several of those areas. Yeah,
and it's a question that I get frequently about this particular piece of work. And my answer, I think, is always somewhat unsatisfactory, and that it depends. So one of the first steps of the toolkit is defining purpose. So for example, if your purpose is to enumerate all of the cleaning supplies that the facilities use and set an annual budget, that's a much more simple and straightforward question that you may be able to answer in a week if there's good records and the scope is small. If your question is, how do we sustain this infrastructure over 10 years, that's a much broader and a much more complicated question. And if there's maintenance records, that will give you a head start. But if there's no maintenance records, then you need to track down your maintenance workers, and you need to work with them to develop a schedule. You may need to visit other facilities because maybe the infrastructure is new and it hasn't needed maintenance before. So very dependent on your purpose, and a week to many weeks, it depends.
Intentionally a leading question, just like asking about costing in your model as well, of course. Thank you. Well, I'll go to Lindsay for one more, but while doing that, if anybody wants to raise their hand for a final question after Lindsay, please feel free to raise your hand. There's a reaction box at the bottom. Go ahead, Lindsay, please.
Sorry, don't have muting abilities.
There you are.
Great, thanks. No, just comments. I think this is great, Darcy. Just put some notes in the chat box here. I think one of the questions about how to lobby ministries of finance and to a lesser extent ministries of health and ministries of water for funding for WASH and healthcare facilities, and that's been a big question on everyone's mind. So Darcy, I think the question that you asked at the very end of like next steps, I think is really valuable there, of how do you align this with what advocates are already doing, and how can the processes that you've developed and information that's being gathered through this be an example and part of the argument and part of the advocates' approach to this, to have more robust information. So happy to share this with the community of practice for WASH and healthcare facilities. Just let us know how we can be assistance, and when the toolkit's ready, we can help disseminate.
Great, thanks. Yeah, we're not just generating data for data's sake. We're really hoping that it helps move the sector forward and helps our colleagues in practice and policy really meaningfully advance towards improving access. So thank you for that.
Wonderful. Thank you, Lindsay. Darcy, we're up on time. Thank you so much for that presentation. Really exciting. Again, if anybody's got further comments or questions or information to share, please feel free to do so through the link in the Pathable chat. Thank you so much. We're moving on to our second presenter now. And this is going to be Pranav Chintalapati, currently in Vancouver, but a graduate researcher when doing this work in the University of Colorado, Boulder. Pranav, let me hand over to you.
Great, thank you. Let me just share my screen. And put this into full screen. So hopefully everyone can see that okay.
That's great.
Okay, perfect. Okay, thanks everyone for being here. So I'll be presenting on some system dynamics modeling work that I did to evaluate the financial and functionality returns of professionalized maintenance services in Kenya. So I wanted to start by acknowledging the co-authors and contributors to this work who are shown here, and also just point out that this work was done through the USAID Sustainable WASH Systems Learning Partnership. And so you may have seen that come up a few times throughout the conference. We had a few different presentations and a side event as well. And we've been active at UNC for the past few years. So just wanted to point that out. Starting with some context. So in Kenya, despite constitutional stipulations devolving water service provision responsibilities to county governments, rural areas still remain largely underserved. And Kitui County, Kenya is classified as an arid or semi-arid lands county and has between 30 to 50% non-functionality of piped water systems. So the map on the right shows the pipe scheme functionality rates of the different sub-counties within Kitui County. And Fundifix is a professionalized maintenance service provider currently serving 24 pipe schemes in Mwingi North sub-county, so the one at the very top. Their guaranteed service model uses performance-based contracts to incentivize continuous flow of water rather than payment for repairs. And so we were curious to know, what is the county-wide effect of scaling Fundifix services? And specifically increasing coverage effect on pipe scheme functionality, total volume of water produced, government repair spending, and community income from water sales. And then to what extent is the cost of providing scaled services recovered through service fee revenue? So this diagram is kind of an illustrative causal loop diagram showing the interactions between different factors that affect service delivery. In the middle, we have this kind of unsustainable cycle where you have pump use that leads to wear and tear and eventual breakdowns, and then the kind of delayed response between breakdowns and achieving county repairs that are contingent on the availability of county government funds. Which in turn are dependent on these national government allocations, which are also intermittent and often delayed. And so when county governments are unable to provide the resources or actually conduct these repairs, then there's also an increased dependency on NGOs and donors to then increase their activities and help offset that difference. Looking on the right side here, so pump use from a community perspective is contributing to water sales. Community water committees are selling water and charging a tariff, approximately 3 US cents per 20-liter jerry can. So that generates some funds which can be used to pay local technicians to conduct repairs. So in green here, I've overlaid the integration of a professionalized maintenance service like Fundifix. And in this case, rather than paying different local technicians, there is contracts that are set up. So monthly service fees get paid to Fundifix, and these are performance-based. So the service guarantees that repairs will take place within 5 days of a breakdown. And there's also a preventive maintenance component, which is reducing the wear and tear and the frequency of breakdowns that take place. And so in addition to these performance-based fees that come into the funds that help provide these services, there's also performance-based funding that comes from a trust fund to supplement that. So you can consider that a subsidy that is occurring, and that's also based on evaluation of performance metrics around the continuity of services provided. So kind of performance-based income coming from two different places. So to conduct this analysis, I put together a system dynamics model. And so this is kind of an illustrative schematic showing some of the model components. The model itself is a little bit messy and hard to see. So this is kind of to show the different components of the model without actually getting into it. So at the top here, you can see we're tracking things like government finances, so the flow of funds from national allocations to the county, and then the spending of those funds on repairs and installations. And then connected to that below is the transition of schemes. So installations contributing to the number of working pipe schemes at any given time, and then breakdowns causing those to transition to states of being broken and then repaired. And of course, this is contingent on the availability of funds to provide those installations and those repairs. And then that is connected to a sector focused on the schemes managed by Fundifix services. So you see this arrow, which represents the uptake as schemes transition from being managed by the government and to managed by the professionalized maintenance services. And then similarly, that's contingent on the availability of their funds. So the income that we talked about, and also expenses for their various activities. So looking at some results. So this is showing a 10-year simulation starting from current conditions. On the y-axis, functional fraction. So the total, or the number of working pipe schemes at any given time divided by the total number of schemes. And so in the table here, we see for the government managed schemes, there's 434 versus 24 for Fundifix. Differences in the mean breakdown durations, 1 to 4 months versus 1 to 4 days. And then in the case of government, new installations, approximately 20 per year, and Fundifix taking up about 1 new scheme per year at their current rate. And what we see is that the professionalized maintenance schemes are able to maintain their functionality across the simulation. Government-run schemes are kind of hitting this kind of asymptote around 50%. And because the county-wide functionality rate is largely affected by the government scheme, it kind of basically follows that pattern. So this begs the question, well, what happens if Fundifix coverage were to increase from approximately 5% right now to a higher percentage and maybe increase their coverage across the county? So this figure shows the effects at different coverage levels. So each data point represents a 10-year simulation at a particular coverage level. So on the left y-axis, we're looking at total volume of water produced across the county from pipe schemes based on a 5%, 25%, 50%, 75%, 90% coverage. On the right side, we're looking at the potential sales income as a result of water committees selling that water that's now available. And what we see is that we're seeing increases in both as coverage increases. Here in orange, we're looking at county-wide water point functionality. And again, what we're seeing is as coverage is increasing, we see that county-wide functionality now increases to meet the rates that were observed within the schemes managed by Fundifix. So even as coverage levels are increasing, we're seeing that the professionalized maintenance service is able to sustain that level of functionality. On the left y-axis here, we have county repair spending. So with less frequent major breakdowns as a result of preventive maintenance and then a shift in repair responsibility, we see a reduction in government repair spending that really starts to kick off after 50% coverage occurs. So look into the costs of actually achieving scaled services. What we did is first had to simulate the scale-up period. So that ended up being about a 65-month scale-up to go from 5% coverage to 90% coverage, and then an additional 10-year operation at that. So this is a 185-month simulation. So over that span, the estimated cost of getting up to and then operating at 90% scale was about $29 million US. And that's broken down into these blue columns for the different categories shown here. And over that time period, looking at the total revenue that's generated from the service fees, we see that offsets about 80% of those costs. So requiring about 92% external subsidy to achieve that level of coverage. The other thing we're curious about is that there is savings occurring from the government repair spending as a result of this coverage. So what if that savings could then be put into the professionalized maintenance funds? To what extent is that helping offset costs? And what we see is that provides an additional 7%, so still about 85% subsidy that's needed. And so this 29 million is based on some strategies around what scale up would look like and the resources required for that. And so if strategic scale up were to look slightly differently, then we could run different simulations and see what those costs would be. But based on the current estimate, that's what came out. So a couple takeaways. Model projections show that scaled delivery of FundiFix professionalized maintenance services could lead to increased rates of functionality and water production, increased water committee revenue from point of view sales, and reduced county government spending on major repairs. The cost of achieving scaled services is highly dependent on external subsidies, as only 8% of costs are recovered through service fee revenue, and county government savings only account for an additional 77%. So I will leave it there and open things up for questions.
Wonderful. Thank you, Pranav, for that presentation. Again, just asking the audience if you want to make a comment, ask a question, please just raise your hand in the reactions box at the bottom or in the Pathable chat link on the other screen. While we're waiting for that, Pranav, can I just ask a quick question? So in terms of scalability and interest in providing those subsidies, have you done a sort of background study of where that might come from? And also, might that be tied into subsequent studies that you're doing in other comparative areas?
So the subsidies right now are coming through a trust fund that's already set up through the FundiFix model. And so they've been looking at different ways of getting income from non-governmental or non-traditional sources, like businesses that are actually operating, private sector businesses that are operating in those contexts, largely through corporate social responsibility and things like that, that kind of incentivize them to put money into services like this without necessarily seeing a financial return. So that's really being investigated by the FundiFix organization and their side of things, yeah.
Wonderful. Rebecca, please go ahead and ask your question.
Yeah, thanks so much, Pranav. I've seen some really encouraging results about FundiFix through the SWS webinars. And I was wondering, in the work that you've done, what challenges you might expect or predict in efforts to scale up FundiFix more broadly in terms of things like, is there suitable human resources? Like, are there enough skilled professionals to take this to a wider scale? Does it apply to multiple contexts? If there are any other challenges that you think might face this kind of operation going more broadly?
Yeah, I mean, there's certainly challenges. Our approach to modeling scale up was kind of built around what the current ratios look like as far as staffing to the current number of schemes that they're managing. To what extent can they take on more without needing to hire? So what we saw is that even though they're operating at about 24 schemes right now, if you were to increase that to up to 50 schemes, the current number of technicians would be able to sustain current levels of functionality and service delivery. But once you start crossing that, you actually are unable to keep up with the number of breakdowns. So that instigates in the model additional hiring to maintain a ratio that allows you to achieve that level of functionality. Now, on the practical side of things, as far as are human resources available in each region to actually do that, I haven't investigated that. My work was largely on the modeling side of things.
Thank you, Rebecca. Fungi, would you care to ask your question? Are you still there? Can you unmute yourself if possible? While we're waiting, let me just ask this from the Pathable. Pranav, isn't FundiFix also receiving funding from Uptime?
There is, yes, they're part of the Uptime Consortium, which is made up of different maintenance service providers in Africa. I don't know the financial side of Uptime and the money that's generated through that consortium.
Okay. In the interest of time, Fungi, can I ask you please to type your question in the Pathable chat box? Pranav, unfortunately, we've run out of time. Wonderful presentation. Thank you. Thank you so much. And good luck with future research on that. That's fascinating stuff. Thank you very much. Yes, in the interest of time, we're moving on to our third and final verbal presenter, the final verbal presenter of the whole conference, to Justine Lee, who is with World Vision and is the WASH Fellow. Justine, let me hand over to you and enjoy.
Thank you so much, Warner, and thank you to all of you for being here. Give me a second while I share my screen. So I know that this is a combined verbal session, so we might have some Econ folks here. That's okay, we will take you. But when it comes to the topic of equity, I know that many of you, regardless of your background and expertise, do deeply care about this topic. It's certainly something that I really care about, and I've also heard from a lot of people that they feel stuck about what to actually do. And it feels, can feel overwhelming and exhausting and all pervasive and entrenched. And we can let that fear of doing the wrong thing, saying the wrong thing. My mom used to say, "Yut bong, yut mong." So, making things worse when we try to help. And we can let that fear paralyze us and prevent us from taking steps to intentionally dismantle and confront some of these age-old systems of injustice and colonial practices that we've inherited, maybe been guilty of participating in or contributing to, certainly that we're all situated in. So today in this presentation about decolonizing WASH research, my goal is just for each of you to walk away with that first next step. And here is how we're going to do it. So first, we'll go over an introduction into the study, kind of explain why we did the study and break down, what decolonizing WASH research means. Then I'll briefly explain, our methods and how we collected this information that you're seeing. And then I'll talk through some of our results, which are mainly the key challenges that our LMIC-based or Origin colleagues have highlighted, some limitations of the study, and finally, some concrete next steps for this project, some of which actually that you can be a part of today. If at any point you have any questions, please put them in the Pathable chat box and I'll respond after the presentation. Additionally, I do want to highlight our team here. Ben, Jayana, Kayla, Layla, Salamata, and then myself, Justine. A lot of them are also here today and they are available and certainly very well qualified to answer any questions. You might actually have met some of them today if you attended our morning session or discussion session, and everyone's emails are here. And we encourage you to reach out if you would like to stay updated or be a part of future efforts. So why decolonizing WASH research? And what exactly is it? To answer this, I want to borrow an example from Sindel, Barrington, and Shaler's article published published in Engineering for Change this past year. And captured in this blue box here, you can see it's an excerpt that the authors have highlighted from their correspondence with a representative from a scientific journal stating that scholars from developed countries will be given priority for publishing free of charge because they're trying to attract, quote, high quality papers. And I think many of us will wish to say that we're surprised, but I would actually venture a guess that many who have worked in WASH research will say Not always is discrimination so overt or explicitly spelled out like this, but there are power differentials that many of us are aware of. And once when I was in the field, a senior researcher from a high-income country used this hand gesture to kind of discuss the power gap between the high-income country team and the enumerators who were doing the data collection in the field. And I don't think that this person meant it in a condescending or malicious way. I think this person was just trying to showcase and illustrate, again, this power differential that a lot of us who have done or are doing WASH research do know is there. And acknowledging that power differential gives those who have the power the chance to yield it. And that is part of what decolonizing WASH research means. To paraphrase from Kessie et al., this article that came out in 2020, it's to try and intentionally undo and unlearn some of these unjust assumptions and practices, as well as trying to persistently take some positive action towards, I think, most relevant for WASH research, alternative ways of knowing or of knowledge generation. So the goal of the study was really twofold. One, it was to spotlight LMIC researchers' perspectives and concerns as voiced by them, and to give them just an anonymous platform to speak freely and frankly. And then second, and probably more importantly, it's to inform next steps for research equity. To accomplish this, we conducted 24 semi-structured qualitative interviews with both senior and junior LMIC-based or origin researchers, as well as some high-income country donor representatives. We spoke with researchers across 8 different countries, so Bangladesh, India, Kenya, Uganda, Zambia, Zimbabwe, Nigeria, and Ghana. And in the end, we had, as you can see, a pretty even split between early career or junior researchers and senior researchers, and as well as male and female participants represented. Our interviews were about an hour long each and covered 5 topics loosely structured around the phases of a research project. So we asked each person about their experiences and challenges in funding acquisition, project execution, research dissemination, career advancement, and then we also gave them a chance to share about ideas for potential solutions, as well as maybe positive experiences and things that have worked in the past. And when parsing through our data, our team first started with the socio-ecological model, which is this framework that allows us to categorize data based on levels of influence. So, interpersonal between researchers and other individuals, organizational, so within a researcher's organization, community and systemic, so between organizations, and then global and societal, so some of these social and cultural norms. Another thing that we did was categorize our data by types of challenges experienced by LMIC researchers. So on a high level, we identified 5 main categories of challenges. And these were, power differentials and sometimes abuse of power, structural barriers due to organizational policy, othering speech, action, and practices, institutional or individual indifferences to the status quo. So, which, as we discussed, can serve to reinforce colonial ways of knowing and knowledge generation. And then finally, we had this bin of country-specific or miscellaneous kind of challenges that came up repeatedly for researchers from a certain country, but maybe was not a common experience across all the countries in our study. Now, before you get overwhelmed by all of this on the slide, I'm actually not going to read out all the codes to you today, and I don't expect you all to read it now either. Instead, I have a handout available so you can look at the file section later if you're curious. You can download it and read through the key challenges as expressed by our colleagues from LMICs. I will, however, highlight a couple of codes here. So for example, S1 here, incompatibilities between donor and recipient systems. So for example, one senior researcher expressed cases she'd seen where donor organizations required LMIC institutions to partner with an HIC institution from the donor country in order to apply for a call. So LMIC institutions couldn't apply on their own, even if it was their idea and they were going to be doing the work, or it was implied or kind of known that their chances would be affected or unequal if they, or it would be affected in a positive way if they were to partner with a high-income country partner. So this of course has implications for code, say like number S4 in the bottom there. My cursor disappeared, but that's okay. Related to budget challenges or unequal allocation of budget. So if there are these requirements and policies in place, but S4 also relates to power differentials codes P2 and P3. So, if an LMIC colleague is cut out of initial decision making and the budget planning process because of this inequitable balance of responsibilities, or there's this disregard for their input in the design phase, that could obviously lead to budget challenges down the line. And then on this slide, I wanted to call out codes I1 and I2, the use of Western metrics when evaluating competency, such as doctoral credentials or English skills, and impacts of English as the predominant language for knowledge, dissemination. Or as actually one of our participants put it, the quote, hegemonic power of English. So that, is certainly a legacy of colonialism, and our continued indifference towards this legacy leads to very many challenges for our colleagues from LMICs. And then finally, for othering speech, action, and practices, as well as country-specific challenges like caste-based discrimination or tribal discrimination, a lot of LMIC colleagues experience othering, partly because of all these other facets related more to more directly to WASH research, as I've discussed, but also because of gender and age, which were two of the things that we heard a lot. And that actually brings me to the topic of intersectionality. So if you're not familiar with intersectionality, it's a term that was coined in, I think, 1989 by Professor Kimberly Williams Crenshaw. And it refers to this interconnected nature of social categorizations like race and class and gender, and just how all of them overlap in an individual or group's experience of the world. So, for example, one researcher said, how do you explain on what grounds the discrimination were? I feel like it was a culmination of your gender, of your identity, of your limitations that you face because you can't publish enough in academic English. So again, going back to that legacy of English as a barrier. Another researcher said, I think the general one that I can say is sometimes just being a woman and, being an African, I think people always have certain assumptions about, you look kind of different from them, especially coming from a different color, totally different continent. And they have these assumptions from what they know, or just thinking, because she's from a certain place, grew up in a certain area, she will be this, she can't do this, I don't think she's capable of doing this. And again, that's an experience of othering. And this was an LMIC researcher who was working in a high-income country. And then finally, this last quote, I think it was like a vicious circle kind of thing, where you were judged on the fact that you didn't have enough projects, but the reason you weren't getting enough projects is because you were not named as main project leaders on the project that you were currently working on. And I really want to pause and acknowledge, this vicious cycle, because that is something that we really struggle to capture in our study. Of course, all the participants that we interviewed are in the field of WASH, and they are working or have worked as researchers. And so, there might be early career individuals who wanted to be a researcher in WASH, but they just found all of these challenges to be too high of barriers. And one of our participants actually put it this way. She said, sometimes we have a tendency to, quote, self-discriminate, in that we want to be in an environment where, we feel welcome and we're not, always experiencing these challenges. So that is definitely something to consider. Another thing we found is that in cases where the intentionality was ambiguous, so it was difficult to really tell if it was discrimination because maybe it's more subtle, like I said in the beginning. It was especially challenging for researchers who were early career to identify those cases as discrimination, especially compared with senior researchers who maybe have years of experience and can kind of see patterns emerging. So this has implications for early career researchers and maybe whether or not they advocate for themselves. And then finally, I do want to acknowledge that this is preliminary work. It does not adequately capture the full diversity of LMIC-based and origin researchers. And something that we were thinking is maybe down the line, we can kind of create some profiles or kind of subgroups of LMIC researchers, and within those subgroups kind of prioritize the key challenges that each kind of subgroup face to kind of target some of those actions more. And as an example, I wanted to highlight, the difference between an LMIC origin colleague who is now working and studying in an HIC. They might face unique challenges to do with immigration. They might face heightened experiences of othering if they're a minority, and logistical challenges like visa, again, going back to the vicious cycle, they're not being put on publications or not being made as project leaders that can affect their maybe visas they can apply for or chances of getting the visa. And then for LMIC-based colleagues who are still in their home country, there are more specific challenges related to dissemination, for example. So maybe they're doing more field work and they're facing more challenges to do with traveling, budget and visas, because a lot of conferences are in HICs. And I pulled kind of a quote for each example. So for the first category, there's always that feeling of working hard to be exceptional just to become regular. When people find out that you're an LMIC person and might need special requirements to stay or to get a job. For LMIC-based colleagues, this researcher said, even if you have evidence in your passport that you've traveled to so many places, there's still so many rules and restrictions. And actually, she shared, she encountered pushback from officials or officers when trying to get visas because of her country of origin. They thought like she would try to stay in the HIC. But yeah, maybe sometimes you're not sure whether you have a budget for it. And then a month before they'll say, oh, we can make a little budget available for you. So quickly you have to mobilize, get your documents ready. And I think these days with online, it's no big deal. So a little glimmer maybe of hope of how to make things more accessible. And so, what next? I just want to leave you guys. So for our project and our organization, we came up with these research equity principles based on the findings. Again, please don't try to read it now. It's available as a handout in the files. But for all of you at this conference, we actually have 2 large group interactive discussions. We had one this morning, we have one this afternoon. I will put the Zoom link to the afternoon session in the chat after this presentation. At the same time, we're also trying to gather email addresses so we can share out data from those 2 large group sessions from this finding and get some feedback, and also to just gather people for further discussion. And so, with that, thank you all for your time, and I will take any questions.
Lovely. Thank you so much, Justine. Fascinating and a very timely presentation. So many questions, but let me, we've only got time for, I think, one at the moment, unfortunately. Rebecca, would you like to go ahead, unmute yourself and ask your question? Rebecca, are you still there?
Yes, thank you. Sorry, I couldn't mute myself.
No worries.
So many questions, Justine. Thank you so much. That was a great presentation. The question I just posted in the chat was, are there easy-ish things that could be done in the very short term to help reduce some barriers for LMIC researchers, like allowing publication in native language with optional translation to English, or something else that would be really low-hanging fruit that we could do in the very near term?
Thank you so much, Rebecca. I think that is a question that a lot of us have. So the question is about low-hanging fruit. And so one of the things that we're trying to do in these brainstorming sessions is to gather different people's ideas, but also try to prioritize in terms of how critical we think it is for change to happen, but then also feasibility, so short-term, medium-term, long-term. So I think what comes to mind just off the top of my head before all this data comes in is in cases where we're seeing experiences of othering, I think that's something that each individual can really take a chance to reflect on and learn. It came up in our morning session, a suggestion to kind of better understand the history of where all of this comes from. And I think that's something that individuals can definitely do. But on the kind of more larger umbrella of actors, we look forward to kind of sharing out more, like a more formal list with everyone. And we really hope you'll participate too.
We need much more time on this, don't we? Justine, I'm sorry. And it comes,
Totally
that's
okay.
the last verbal presentation of the whole conference. Many more questions. Please, if anybody has further to share or to ask, as Justine said, please go to the 3:30 session, also in the Pathable chat. I just want to thank all of our presenters and all of our participants and guests for being here for this last verbal session. Thank you, everybody. I just want to again thank our sponsors, the Limpopo Resilience Lab, USAID Southern Africa Coalition, World Vision, and Clean Water Here. I direct everybody, we have a couple of wonderful, we have posters next, and then we have a couple of wonderful sessions that are happening at 3:30, overlapping the trivia plus Justine's session. So enjoy. Thank you all, everybody, for attending, and please follow up and get the files from the Pathable link as well. Thank you, everybody. Have a pleasant afternoon.